At least 3 staffers in Gauteng Health MEC Bandile Masuku's office have tested positive for the coronavirus. This includes spokesperson Kwara Kekana and Parliamentary Liason Officer Tebogo Thothela, who have both gone public about contracting COVID-19. Newzroom Afrika understands that Masuku's most recent results have come back negative. Gauteng has seen a surge in the number of coronavirus infections, with Premier David Makhura predicting that cases will surpass 1 million towards the end of the year. Thothela spoke to Newzroom Afrika's Ziyanda Ngcobo about his journey since contracting the virus.
You have been on the front lines of fighting coronavirus. I know we've been out on stories together, be it in Alex and other parts of Gauteng. And of course, we know that the numbers are set to peak in the millions, in fact, later this year. What does it mean for you as a healthcare worker being in the front lines testing positive and the message that, against the stigma? Because I think you were deliberate and actually going public with your COVID-19 results. So what does it mean as a healthcare worker to actually come out publicly, but also in terms of your efforts in terms of fighting this virus?
For me, the one thing is that, the minister and the MEC, Dr. Bandile Masuku, had always prepared us. So from March, you would have seen that they kept on saying that the reality is that quite a lot of people will get it. And noting that we are with the MEC quite a lot in the hotspots, one was it was an eventuality that I had said that it may one day happen. And I think what I appreciate is just the general level of support that we've received, both from the employer, from family, from friends. And the reason why I came out was because we thought it important as an office that there's a lot of stigma that we've had to deal with in the last 3 months. A clinic closing and then people insisting that it must be closed for a week, health professionals who are then stigmatized. And it was important for us as people in the office of the MEC, led by the MEC, to then also practice what we preach. And I think that was the thing, to say that, look, I've got it. And even though I've got it, I'm largely asymptomatic for now, and I hope that it stays that way. And they ought to not be stigma, because in 10, 11 days, there's a chance that I'll be back at work. And we would not want people to then stigmatize. They must know that when they see us in the front line again, and when we're back there working with the MEC, there's nothing untoward, and that's why it was important for us to be part of the people who are fighting the stigma during the time, so as to ensure that what happened during the AIDS pandemic would not happen during this COVID pandemic as well.